Affairs, and I will be talking about implementing stricter staff qualifications in childcare settings and daycare facilities. The problem. What is the problem? The problem is child safety and well being is at risk due to child abuse and neglect in daycare and childcare facilities with staff lacking proper training and credentials. In 2017, Turley Law Firm stated that 2,237 different daycare providers across the nation were reported for abuse and neglect. And also to add, the DCFS stated overall, staff doesn't require completion of college and equivalent experience is accepted, which is equivalent to a 2-year degree. And also, student and youth aides can be as young as 14 years old. Background and context. What can lead to child abuse and neglect? According to Queensland's government, factors like lack of support, experience, skills, stress, substance abuse, low self-confidence, mental health issues, and history of abuse and neglect are factors that can lead to child abuse and neglect if anyone who is on staff at daycares or facilities have any of these traits. So CAPTA is an existing policy that provides grants to support prevention, assessment, investigation, prosecution, and treatment of child abuse and neglect. The Administration for Children and Families, ACF, is a U.S. government agency that works to improve safety, stability, and well-being of children and the prevention of child abuse and neglect. This agency authorized the Child Care and Development Fund, which requires background checks prior to joining child care staff and requires them to get background checks every 5 years following their employment. Proposed policy solution. Action should be taken to implement a policy that requires stricter staff qualifications to ensure that children are being cared for ethically and cared for by qualified personnel to address child abuse and neglect. Who implements this policy? Government agencies are responsible for implementing policies regarding child safety and well-being, while other organizations are responsible for things like reporting incidents or suspicion, investigating reports, and providing resources that address child abuse and neglect. How can the problem be addressed? The problem can be addressed by having mandatory training provided in-house, require continuing of education to keep staff up to date on best practices, and requiring minimum education in the child care field or early education. Supporting evidence. In research conducted by the CDC, they present that caregivers who practice parenting skills have obtained higher education and maintained consistent employment and have characteristics that are protective factors that align with and support the implementation of this policy. A similar policy to this policy is background checks. And the requirement of background checks on all childcare staff is a common policy used for this field of work, and it's comprehensive to ensure it's appropriate for candidates to be around children. Possible counter arguments to this policy could be staff shortages and expensive childcare. Staff shortages can be addressed by using incentives and bonuses to attract candidates, and expensive childcare can be addressed through support of stakeholders and donors to help with costs. Future outlook and recommendations. Expected outcomes could be more qualified staff, more trust in staff, improved well-being of children, and implementation of mandatory ongoing training. Consequences could be if action isn't taken, then there's a higher risk of child abuse and neglect occurring, negative impact on child well being, decreased quality of care, and loss of trust from parents. The next steps to implementing this policy would be securing financial resources to achieve policy implementation, collaborating with the community to build a strong foundation to avoid resistance to the policy, and using different outlets to reach different audiences to gain support and backing. Thank you for your time, and I hope you consider implementing this policy.